Hi, Lindsay. Why don't we take a seat and talk about your pain real quick, okay? So, what I think is going on in a nutshell is that, well, first you've been experiencing this pain for a while now, for a few years, in fact. And I know you've had an MRI and you got it looked at, you got checked out, and it showed that you had some mild degenerative disc disease. And that sounds very scary. Um, so I totally sympathize with you, especially if you've never seen or experienced that before. It is very stressful, and I do recognize that. But we're going to talk about what I think is going on a little bit deeper than just mild degenerative disc disease. Okay, so I want to ask you, what do you know about pain? Right? Do you think pain is necessary? Is it necessary? Right? Well, if you were to step on a nail, you would want to know about it, correct? You would want to. Why would you want to know about it? So you know you can pull it out, right? You don't. You're not supposed to have a nail in your foot. That's not. That's not natural. That's not normal. So pretty much what happens when you do step on a nail, or if some other injury happens to you, there are receptors in whatever part of the body that's injured, and they sense that threat or that danger that occurs. So you step on a nail, that threat message is sent to your spinal cord and then up to your brain, and then your brain interprets kind of what level of threat that is. And with stepping on a nail and there's a nail in your foot, you'd want to know about it. So your brain also gives off a pain response, and that's pretty much telling you, hey, this nail should not be there, right? And I think what's going on with your neck, because you have been experiencing pain for so long, that pathway is kind of junked up a little bit. There is something not working properly. Um, and you can almost think of it like this. Say you have a brand new car, right? How it normally works is that someone, especially for their car alarm, a quick analogy for their car alarm, if it's going to work properly, someone has to bash in a window, has to cause some major damage for that car alarm to go off, right? And that is a normal person's nervous system, right? Real danger, very violent, very, damaging, and car alarm goes off, pain response, right? But I think in your case, you have this car alarm that has a little bit more sensitive, or you have this car that has a very highly sensitive car alarm. Okay, so that could be someone brushes by, the car door or just taps the side mirror, boom, and that car alarm goes off. So we can kind of think about that when thinking about your neck pain. I do think that your receptors and your nerves that are communicating with your brain, they are kind of at a heightened level. It doesn't take very much stimulus. It only takes a light tap to cause some pain, when in reality it should be, lower here. Someone needs to punch you, needs to bash in your windows to cause the amount of pain that you're feeling. And I know you do have some stressful times with your grandma, and getting that MRI and getting that label of mild degenerative disc disease probably caused some extra stress as well, and that may be influencing how your nervous system is working as well. So there may be some other factors that are, you know, adding to the amount of pain that you're feeling in terms of stress. But I do think that you are having a heightened and very sensitive nervous system right now, and pretty much the lightest of touches or the faintest of brushes are causing you pain. So we'll talk about that a little bit more down the road, but that's kind of what I'm thinking, and we're going to play around with some techniques to see if we can help you out with controlling this pain. Okay?